Welcome to another edition of Wellness Watch, sponsored by the African American Wellness Project and BlackDoctor.org. Hosted by Dr. Michael LeNoir and Mr. Ellis Dean. Today's topic, Does Your Doctor Respect You? Looking at unconscious bias in healthcare with guest Dr. Rodney Hood. So please welcome Mr. Ellis Dean, who's going to keep us on track for the rest of the hour. Happy watching.
Good evening, and welcome to another edition of Wellness Watch presented by the African American Wellness Project and BlackDoctor.org. Of course, I am your moderator / host, Ellis Dean, and we are happy to have you here on another Wednesday evening where we're going to give you some of the wellness news that you can use to keep your life going happy and healthy. So, a big show tonight. We are excited to welcome Dr. Rodney Hood back with us this evening. We're going to talk about, does your doctor respect you? And we're going to give you some tips and tools on how to have your doctor give you the respect that you deserve. Now, understanding that when you walk into the office, you should have some respect, but we're going to give you some tips and tools to get that respect to another level. We're going to share some tips and techniques for that with Dr. Hood. But as you know, as we do each time at the beginning of every show, we have a couple of questions we want you to fill in. We want you to let us know where you're watching us from. So put in the comment section where you're watching us from, your city, state, area, your high school, whatever you want to put in there to let us know where you're watching from. Also, we want you to tag a friend, share this show with a friend. If there's information that you feel somebody could use, please tag them and let them know that this is a great show for you to watch this evening. And as always, I'm not here alone. I have got to bring in the man of the hour, and that is Dr. Michael LeNoir.
All right. Well, thank you very much for introducing me as the man of the hour. I thought I was broader than that, but we've not established that yet. I want to welcome everybody to the Welcome Watch today. Glad to have Mr. Dean back. I think we've seen how the ship goes without him at the helm, so we won't want that experience anytime soon. So welcome back, Mr. Dean, and everything's good for you.
Thank you. Yeah, it's good to be back.
Today we're going to talk about something that we at the African American Wellness Project have been talking about ever since we started the Welcome Watch, and that's how you're organized to go into the healthcare system depends on your outcomes. And we're going to start with a few things before that, but I want you to stay with us because we're going to give you some tips about how you can enter the healthcare system and get the best possible outcome. And we'll try to do that every week. But first, a few things in the news. A lot of craziness going on in the country, obviously around the vaccine. Fights around masks, the use of ivermectin, which is a animal drug for the treatment of COVID-19 has gotten some play. I just saw an article where a judge in one of the cities has ordered the hospital to treat one of the patients with ivermectin because the patient requested. It is for animals, horses, and sheep. There's no evidence that it has any impact on COVID. In addition, a lot of the anti-vaccination people are getting sick. Some of the right-wing radio hosts have died because they have not taken vaccinations. And today, one of the premier stars of YouTube, who has been talking against vaccination, also got the vaccine. It looks like we're slowed down to almost a crawl in this country. I saw another article that says 15 million doses of the vaccine have been thrown away because they went unused or they weren't properly managed. And so a lot of madness going on in the country. We know how to get out of this pandemic, yet we still are not doing that. And so consequently, I don't want to harp on that, but I think we need to really start to think seriously about some other strategies because it doesn't look like we're going to be away from the acute impact of this virus very soon. So that's still kind of dominating the news. There are other issues around diabetes. We talked about the fact that for people who are getting screened for prediabetes, Dr. Hood's an internist. He might this may be something he probably already knows, but hey, who knows, we might be slipping him a tip that they want you to screen these people now at 35 instead of 40. they keep dropping these numbers down because they keep finding a fair number of cases that started at those ages. And so consequently, they have dropped the pre-screening for diabetes down to 35. Still, African Americans, people of color, have much more trouble with diabetes now than other ethnic groups. And so exercise and diet, but also your attitude and the amount of education that you get about your diabetes and about how to care for it seems to determine how successful you are in controlling your blood sugar. So a lot of things in the news, but COVID-19 obviously still sucking up all the oxygen in the room, as it should be, or it shouldn't be by now, but it still is. So
I just want to clarify one quick thing, because ivermectin is an anti-parasite medication.
Right.
It can be used in human, but it's typically used to deworm animals. So that's what it's typically used for, and it says it's an anti-parasite. It can treat infections caused by roundworms, threadworms, and other parasites. And so I don't know how it has gotten to become the treatment du jour for the anti-vaxxers, because as we all know, that coronavirus is a virus, not a parasite, or caused by a parasite. It is an airborne virus similar to the common cold. It's a virus similar to the common cold. So just because it was primarily found in animals does not mean it is can be treated with something that's primarily used for animals. And so I would suggest that, so if this gentleman wanted to use it and the judge is ordering it, then I would say he would have to probably sign something that would absolve the hospital or whoever administered that medication to him of any responsibility if he gets ill or has any ill effects as a result of taking the ivermectin. So that's just kind of some clarification.
Yeah, I don't know where this came from. I really don't. I think it's another one of those anecdotal types of treatments. Can be dangerous for some people. Parasites are completely different organisms from viruses, and there's no rationale.
It is. Simone, I just want you to really just look it up, because the FDA is saying that you should not use ivermectin to treat. So the top medical associations are saying ivermectin is not indicated to be treating for COVID. So I'm not saying it can't be used in human, but what I'm saying is that it's not being recommended to use to treat COVID. And so if that is your belief, then please put the link to the organization, to the medical organization, legitimate medical organization that is saying that ivermectin is indicated for COVID. Thank you. I'm sorry to interrupt.
The other thing, I don't know how a judge can order how a patient is treated. I mean, if I used everything that my patients want me to use for the treatment, let's just say of most common viruses, most patients would prefer an antibiotic. And then now, am I in a situation where a judge can call me and say, I want you to use an antibiotic because the patient wanted you to do that? I don't understand where the jurisdiction things come in. I think that's what makes it even more puzzling to me. But here again, we're going to have to get over this. I think how many more people are going to have to die? I heard Dr. Fauci say between now and Christmas, 100,000 more people could die if we don't increase the vaccine rates. And so here again, we're starting to see in our area, young people are starting to get vaccinated. And maybe now I think that some of the information is getting through. But it's pretty clear to me, there's a study, I don't know what you know about this, Ellis, that it said that most of the money comes from federal government, very little of it goes to the black media.
Yeah, I saw that article.
And so maybe we're not getting the resources we need to talk to our community, even though they put us on a pedestal of being a number one on the concern sheet. I told you last summer that that was going to disappear by the fall. But I think that it's just incredible what's happening in terms of how we're dividing a small segment of our population into this madness. But here again, let's not forget some of the other things. So let's take time now to was there a question? Was that a question that was up there? I didn't see it.
That was just a statement when you were talking about diabetes. It's from one of our YouTube viewers. source of life touch. It's 90% increase in type 2 diabetes in children
Yeah.
since the beginning of the pandemic, and that is that is definitely a believable statistic because, matter of fact, what I just did with Dr. Coleman last night, we did a show on diabetes, and we kind of talked about the type 2 diabetes and all types of diabetes. And so when we're talking about, I completely agree that. And so I would say you can get your own home testing kit and find out if you're pre-diabetic. And that is if your blood sugar level is between, I believe, 100 and 125, puts you in that pre-diabetic state.
Yeah.
And so if you have that, so if you're in that pre-diabetic state, there's ways of diet and exercise that you can move back to a normal blood sugar level. But once you cross over to diabetes, once you cross over that blood sugar and get diagnosed with diabetes, you're always going to be susceptible to having a diabetes. And so you're going to have to really monitor it. So, and there's about 88 million adults in America living that are pre-diabetic. So make sure you need to do what you need to do and make sure you check your children too.
Yeah, the other thing too, while we're talking about it, you can go to the pharmacy now, or drugstore, Walmart's place, and get COVID testing kits. I think they're $23 for 2 kits, and
Yes.
so you don't have to wait around. So even COVID is available now, along with testing.
I have a few in my home now.
All right, you're ahead of the game. All right, so let's go now to our special guest, Dr. Rodney Hood. Dr. Hood is an internist who practices in the San Diego area. He's always been interested in health disparities and healthcare disparities. He's the author of the theory on the slave health deficit, which is one of the explanations for why we as African Americans get so sick with these chronic diseases. And so we want to welcome you to our program, and we want to set the context. So welcome, Dr. Hood. Thank you for joining us.
Thank you.
We started this program because of an incident that Mr. Dean had, and I hope he doesn't mind me sharing this in a very general contextual way, at a hospital when he was there for an issue around the COVID virus. We've been saying at the African American Wellness Project, ever since we started 20 years ago, that if you're not organized when you go into the healthcare system and you don't demand the kind of services that you should have, and you don't get your questions answered because you're not organized, you're not going to get the same level of care. And Mr. Dean, while you don't have to get into specifics of the individual involved, can you tell us what that experience was like? And we have Dr. Hood respond to it.
Well, it was definitely interesting. So my son, who is age 14, had gotten his second COVID shot last Sunday. And so about on Tuesday, really beginning Monday evening, but really on Tuesday, he started, feeling, kind of malaise, congested. Some of the things he started experiencing, some of the symptoms that they tell you that you could get, within 48 hours of having your second COVID shot. So, of course, as parents, we kind of felt it was that, but we wanted to be sure. So I took him into urgent care, and we got so we're waiting. Of course, you wait. And I think the wait was at one point, Dr. LeNoir texted me. He was like, "What's the result?" I was like, "We're still waiting." It was like we just sat. And then when they finally called us back in, it was interesting because, they do all the things. They weigh you and they get your height, which I don't know why they're getting height and weight, but it is what it is. And then they took us to the room, and so they asked us why we're here. I said, well, I explained to them. I said, he just got his COVID shot on Tuesday. And then I started telling him, I took his temperature this morning. I took his temperature this afternoon. Here's what his temperatures were. Here's the medications he had. So I started listing all of the things. They're like, oh, okay, that was great. Doctor comes in. So the nurse goes out, doctor comes in. She starts asking it. So I go through the list again. Hey, here's what he got. Even though I told the nurse, hopefully that was been relayed to the doctor, but apparently it wasn't. So I went through again. And she's like, oh, okay. And I kind of saw her face kind of get, oh, okay. It was almost, it seemed like it was an unusual experience that somebody had that kind of information. And so I asked, So I asked my son, I said, Cameron, when did you get the Motrin? Because I said, I know, my wife had given him some Motrin. I said, when did you get the Motrin? And he said, I didn't get any Motrin. And he said, and I said, what? I said, the pain pills. And he goes, oh, it was Advil. And I said, well, son, and so the doctor and I said, well, son, it's the same thing. It's both ibuprofen, and then I started going, it's anti-inflammatory, acetaminophen is Tylenol, and naproxen sodium is Aleve. And she kind of looked like she was working, she kind of looked back and she said, oh, okay. And I said, yeah. And so then she started doing the exam and she started touching him and getting him checking his. I said, and when she rubbed on his face and his neck, and I said, well, what are you checking for there? Well, I was just trying to make sure that it wasn't swollen. I said, oh, okay. And then he had been complaining of a sore throat. And I said, so you're not going to test him for strep throat? He's got a sore throat. Are you going to test him for strep? And she said, well, I didn't see any swelling in the back. And so she started explaining why she wasn't going to test him for strep. And then she said, you need to listen to your father. He knows what he's talking about. And so I said, okay. So I kind of chuckled to myself at that. And then she went out and she came back with the PCR test and explained why she didn't have a rapid test. Hey, we ran out of rapid tests. We're going to do the PCR. This is a better test, blah, blah, blah. And I said, okay. So he was getting upset because he wanted to return to school, and he realizes that the PCR test takes about a day to get the results. And so she said, well, I'll write him a letter so he can stay out of school. And I said, okay. I said, well, do you think if I went to a rapid test center and I got a negative result that he could go to school? Because I know because he had a football game, he wanted to play in the game. So he would, there was other kind of social factors that he had with that. But I wanted to make sure he was clear. I said, well, do you think if I took a rapid test? He just said, well, yeah, you could do that. But, the PCR is the test is the best. I said, yeah, but we just kind of wanted to make sure that there was other options available to us. And she said, oh, yeah, sure. So she walks out and completely like demeanor of Mr. Dean. It was all of that. And so and I was telling Dr. LeNoir the story. I said it was kind of interesting to see how the level of care switched tremendously. And it wasn't that I knew a lot, but I had the information ready to go. So when I came in, I knew temperature is a big thing. So I knew, hey, I tested him early and I had the numbers to support that. I had the medications that I had given him. So these are standard questions. So when we're talking about being your own best health advocate, these are the standard questions that you're going to receive. And the way you answer those questions, in my opinion, and Dr. Hood, I'm going to throw this to you. The way you answer those questions and how prepared you are in that visit, whether it's an urgent care visit or your regular visit, the way you answer those questions, how prepared you are, will determine the level and quality of care. It shouldn't, but I think it does. Am I right about that, Dr. Hood, or what are your thoughts?
So, Mr. Dean, you're 100% right. And you went from the usual Negro to one of those smart Negroes. And in America, they deal with, in their perception, a smart Negro different than the usual Negro. And it gets off into the whole issue of bias and assumptions.
Right.
I'd like to take 1 minute, though. You talked about ivermectin. And as you know or don't know, I've been appointed to several COVID task force at the state level. I've been asked to chair the National Medical Association COVID task force. And so the issue of ivermectin, where did this come from? I can't tell you in the past month or so how many times I've been dealing with this question with my patients. So just from a fact base, if you remember when COVID first hit, it didn't seem to be that advanced in India. And people were saying they must be protected. Now, ivermectin is commonly used more so outside of this country and other third world countries because they have a huge rash of infection from parasites. And so a lot of folks in India were taking ivermectin, etc. And some people without any data suggested, well, we believe it's the ivermectin that's protecting that population. The Indian population later on started meeting in huge, without vaccinations and whatnot, in huge gatherings. And as you know, all of a sudden it exploded in India. And as a matter of fact, because the virus was multiplying so much in India, it developed a mutant called the Delta variant that's now here.
Right.
And there is one study, and I don't want to call it a study, out of Israel that looked at about 89 or 90 patients in which they used the human dose of ivermectin, because they do use it for humans in a human dose, and supposedly saw that half of those patients who had ivermectin, fewer of those wound up with COVID than those who were on it. And it's that data, and I don't really want to call it a study, that people said, well, we should be using ivermectin because it protected them in India. They're using it in Israel. And the fact is that study, because when folks tell me, I said, what are you reading? Send the information to me. That's how I got that information. But you're 100% correct. It is not documented to have any effect in the COVID situation. And it gets off into bias, okay?
Right.
And what you talked about. So in essence, once when people believe they don't trust this vaccine, they have an issue with this vaccine for whatever reason, they start looking for information that supports that bias.
Right.
And they use the information, whether it's valid or invalid, to justify that conscious or unconscious bias so that they can continue believe what they want to believe. Specifically about your situation, you're 100% right. I just want to talk about some data that most people don't know.
Okay.
In 2009, there was an article published in the Journal of Health Care Poor and Underserved. There's a test called the Implicit bias test, in which you can actually take, and by now, over 1 million, close to 2 million folks have taken this test. And what it does is it measures your conscious bias. Conscious bias is, I prefer blue over green. I prefer blonde hair over black hair. And then your subconscious bias may show, although you say you prefer brunettes, subconsciously is saying that you prefer blondes.
Right.
There were so many folks that took it, they were able to subcategorize these folks into whether they were physicians, non-physicians, lawyers, and attorneys. There was a subset of physicians, and let me tell you what it showed. Physicians overall had higher anti-Black biases than all other test takers. So when they compared us to lawyers and other professionals, our anti-Black bias on this subconscious bias test showed that physicians had a very negative view of Black folks. All physician ethnic groups showed some degree of anti-Black bias, except African-American physicians were close to neutral, especially African-American female physicians. Wow. So just because you have a bias, does that mean it affects your judgment? Okay. Most folks don't believe so. In 2007, published in the Journal of General Internal Medicine, there was an article that tried to address this question. And it was one of the first articles that did that. It looked at young practicing physicians in Boston, in internists and working in the ER, family practice working in the ER, and I think in Atlanta out of Grady. And they did a scenario where a patient came in with a certain diagnosis. And it was a test in which they looked at blacks versus whites. And they had measured their biases subconsciously and and otherwise. And what they found was that the individuals that had the highest anti-Black biases or more pro-white made more negative decisions for Black patients than they did for white patients. That was 2007. So there's been many other studies since then that suggest that. Very seldom do I hear this study quoted elsewhere. So what you're saying is that now when you go to the ER, how do you combat that particular bias that's going to take place because of who you are? And what you did, I can't, everybody may not have your knowledge base, but at least act like you know what you're talking about. Okay, that will get you better treatment.
Yeah, I've said this many.
I think there's another bias that's part of it, and I think what you talked about. And for those that don't know, I don't disclose it on a regular basis, but I got certified in diversity and inclusion, and so it's called confirmation bias. And so what happens is when you have that implicit bias, when you have that unconscious bias against whatever it is, whether it's blondes, blacks, whatever, it doesn't matter. When you have unconscious bias, what happens is our behaviors change to confirm that bias. So we have this unconscious bias. In this example, we have this unconscious bias against Black patients. And then what we start doing is behaving in a way to make those patients respond in the way that we expect them to. So what happens is we start treating them poorly. We start giving them medications that might make them sick or something that the less potent medications. And what happens is this: those Black patients feel that and say, you know what, I'm not going back to the doctor. And then that doctor says, see, I told you Black patients don't respond and they don't come back and they don't follow up with their treatment. So why should we give them the best treatment if they're not going to come back? That's confirmation bias. They created the outcome based on their unconscious bias. They created that outcome to continue their bias and to support it.
Don't you think it's a matter of respect? I mean, I think that's where it starts. I mean, I've had many instances myself when I've gone to the emergency, dropped my wife off the emergency room. 3 hours later, I come back and nobody's paid any attention to her. And I go in there and they ask me why I'm there. I said, well, my wife is here. All of a sudden, people start scurrying around, trying to do things, trying to make up for the fury that she's about to unleash throughout the whole emergency room because of the way she's been treated. It's a matter of respect. You and I, Rodney, I'm sure we've heard it. We're in the doctor's lounge. I mean, they're talking about, I saw Mabel yesterday. I saw Willie, and and there you can tell that they have absolutely no respect for Black people. And I have said this many times on our program. This is why we started the African American Wellness Project. If I get sick in a city, I have an emergency. I'm taking a suit and a tie, even though I'm not wearing it. I'm putting it on, taking my briefcase, and I'm going down there. I'm still not going to get the same treatment, but at least they'll say, well, maybe this is somebody we should pay attention to. I can give you one more quick example. I go to the hospital, making rounds. There's a judge's wife, a Black judge's wife. She's crying in the lobby. She'd been out of the country. Her husband had an intracranial bleed, and he was bleeding, and he decided to come back to this country before he got treatment. When he got back here, his doctor in San Francisco said, well, doesn't sound like it. He said, no. So he goes to the emergency room. He goes to the emergency room. They find out he's got a subarachnoid bleed. They put him in the emergency room. The neurosurgeon comes up, sees him, and does not come back for 12 hours. Not come back for 12 hours. I mean, and he's a Superior Court judge in this county, in the one hospital that we do have. And so I'll go up there, of course, I have my usual tantrum, because I believe in acting Black when these situations occur. There's nothing like acting Black in a situation like that.
I've seen you, Dr. LeNoir.
But if this is a judge, this is the judge. I mean, and his wife is crying because she's not getting the care that she expects. And all of a sudden he's going to a private room and all that happens. But think about the average brother or sister and with their children go to these emergency rooms day after day after day and encounter this almost 100%.
Yeah, I like to add there was a physician, and her name slips me, up in Indiana, who actually wound up with COVID, went to the hospital, went to the ER, and she used social media to document the poor care she was getting, although she was a physician. And they still responded to her like she was just a regular patient. And I think it goes to what I call subhumanization. They have dehumanized Black folks, so it's even deeper than respect. Okay, it's like on a subconscious level they have dehumanized us. I can go back to my actually what got me involved in this whole issue of inequity and, as you say, respect, is my early experiences growing up in Boston. I was a little boy. My mother, I grew up in Roxbury, which is the poor area of Boston. My mother was taking me to City Hospital to a usual clinic. The clinic is full of patients, white, mostly white, Black. There was a young white resident was calling patients, Miss McDonald, Miss McDougal, Miss Castellano. And all of a sudden, I heard my mother's name called, Evelyn. And I'm young. I jump up. Oh, hell, I'm tired of waiting. I heard him call her name, and she grabbed my arm and made me sit down. And I'm about 9 or 10, and I'm looking. He's calling you. So he's looking at her, and finally he walks over and says, Evelyn, it's your turn. And my mother looked at him and said, I did not give you permission to call me by my first name. It's Mrs. Hood. Grabbed me by the hand. We walked into the room. She never said another word to me. Now, I am very embarrassed because now the whole office is looking at us, and I'm more angry at my mother than anything else for embarrassing me like that. But that stuck with me, and that was total disrespect. So we're going back 50 years in the health system. We have been disrespected in the health system to the point when I opened up my own practice, I insisted that all of my staff address patients by their last name until they gave you permission to call you by your first name.
The doctor's name was Dr. Susan Moore. Thank you, Shonda, in the comments for giving us that name. It was Dr. Susan Moore. She was in Indiana. She had COVID and was able to describe her symptoms. She knew exactly as a physician.
Yeah.
She was able to describe her symptoms and told the doctor what she wanted, what she needed, and they said no. And it went round and round. She was discharged, and she had to get readmitted, and she ended up passing away. So that was a physician. So if a physician gets treated poorly,
it's institutional. That's institutional. I had to go up to the nursery because I noticed a pattern. When there was a Black patient admitted to the intensive care nursery, they would send them right back down to you in a day or so. You know, you have a baby in the hospital, baby gets sick, maybe hypoglycemic or starts having respiratory distress, and you move it up to the nursery. Okay, so then what happens is the nursery takes care of it, and then they send it back to you when they feel the baby's stable. I noticed there was at least 24-hour difference between when I sent up an African-American baby, especially one with Medicaid, than when I sent up a white or Latino baby. They would keep them until they got out of the hospital, but they send them right back to me, of course. I took some, I waited around, I didn't say much. I documented it for almost 2 months, and I presented it as a study spontaneously. And they said, well, it's not true. I said, well, I got Willie over here. He comes down in one day. And I got, her Hortense over here, and she stays 3 days. And so it's institutional. It's not, and they weren't even aware of it. And they apologized. They apologized to the whole department because they said, well, this is something that we need to look at. And they did look at it. But I think it's institutional.
That's part of the unconscious bias, right? So, and Dr. Hood points to it. It's like we have been dehumanized for over 400 years. And that's and even to this day, when we put a sign that just says Black Lives Matter, think about the reaction. Like, think about how visceral that reaction is from a percentage of the country. So I'm not trying to paint with a broad brush, but I am saying there is a segment of this country that has a visceral reaction just to see the words Black Lives Matter, not matter more. You know, they put the imaginary more at the end of matter. So we're talking about that. And so Sadie, I get you in terms of, if she said a comment, discussion reconfirms her commitment to switch to a qualified female African-American physician. The reality is this: there's not enough Black physicians to treat all the Black people in America. So, but the studies have shown that Black patients do significantly better when they have a Black physician as their primary care physician. So, you know, that's no surprise there. But what we have to do, and what the African American Wellness Project is doing, and what Black Doctor's doing, and what Dr. Hood is doing, is what we're trying to do is get everybody that's watching this program, everybody that watches this program, we're trying to give you the tips and tools to get the best care that you can if you encounter a doctor or physician that has some biases, that's not going to give you the best care. Because if you reject that care, whatever it is, then you're going to confirm what they're doing. And you're there to get care, understanding that. You need care. You're there where you're presenting to an emergency room or you're presenting to your primary care physician. You need care. And so what we're trying to do is give you the tips and tools and techniques to get the best care that you can from the physician that's in front of you.
Yeah, so that kind of leads to a suggestion as to how can folks out there get a physician that they believe doesn't exhibit the bias against them. And there is no one thing that I'm going to tell you, but the system approach, and Dr. LeNoir will tell you, everybody's talking about they want to create a system that's efficient with quality, that's improves access and cost efficient. That's at the system level. At the individual level, what we as a patient, now you're going to a provider. Mm-hmm. What is your trifecta? You want to make sure that physician is qualified. So you're interested in quality too. Check out his credentials. You're also interested in trust. Is this the type of individual that's going to protect the sensitive information you're feeding him? But more important, does he care about you? And how do you determine whether he cares about you? You need to start, just like you get interviewed for a job, you should interview your physician. If a physician doesn't have time to answer some of your questions, that may be one of the signs. Maybe he doesn't really have time to. Now, let me grant you, as a person who's still seeing patients, I don't have a 30 minutes or an hour to spend with patients to have a whole dialogue. But when a patient comes in and starts asking me questions, I say, let me answer some of your questions. I care about you, but I'm hoping to continue this dialogue as we go along. When you get a provider that doesn't want to answer your questions, here's the medication I gave you, take it, doesn't really explain it, he's not taking the time to develop a relationship with you, I would be concerned about having a relationship with that physician.
Yeah, I think that's one of the things. I think being organized when you go in there to ask questions, don't accept second opinions, that just somebody tells you that this is somebody I want to go to, you need to know that could be somebody's brother or cousin. You want to get the best person. Don't hesitate to do that. So there are lots of things that we have on our website about at the African American Wellness Project, BlackDoctor.org as well, that have to do with the things that you need to do to build your own healthcare system. We've said for a long time, this system is not going to change anytime soon. George Floyd has been forgotten. I bet if you ask 35 people who are not Black, who was that guy in Minnesota that got, strangled by the police, they won't know his name. So that you're going to have to go into the system with the tools that you need to get the kind of outcomes that you want. And so I think that's just a critical thing. Each one of us has had experience. And how often, Dr. Hood, you get calls from people who say, well, could you please call the hospital and find out what's going on with so-and-so, because I'm trying to get there. My mother is in the hospital and doctors won't talk to me. And you call over there and they can't give you enough information.
Exactly. No, you're right. So it is, if you know a healthcare provider, that helps. If you know a friend, that helps. But let's be real. And let me say something else. The data, as Mr. Dean stated, clearly states that people who align with folks who look like them, sometimes their outcomes are better. But we don't have enough folks who are Black that look like us to take care of us. There are Hispanic, white, Asian physicians, and some of them are very good physicians. Some of them will tune into your needs. You just have to make sure that they fall into the category where they really care about you. So just because they don't look like you, don't mean that they can't be a good advocate for you, but you need to inquire about them and judge how you feel they care about you.
And one of the things,
say, as an end user, I would say have a health buddy. So like the health buddy could just be this, right? So I write down what medications. You write down if you're diabetic, you need to be tracking your own blood sugar. You can be testing it on your own. If you have hypertension, you need to be writing down what your blood pressure is as you check it yourself. And so that way, when you walk into that doctor's office, the more information you have, right, okay, the more they're going to do what they need to do to take care of you. And the second thing is, if you don't feel comfortable having that conversation, take a friend with you, take a family member that's going to have that, and that's going to be your healthcare advocate and stand in that space for you, right? So, I go in there now, like when I go with my kids, I go with my wife, I go with friends, I start asking questions, and it's intentional. I ask very specific questions because I've worked in healthcare. So when you ask very specific questions, you're sending that signal, I know what I'm talking about. And so therefore they can't just go, oh, don't worry about that. No. I need to know what that is. Okay. Why, and then when I ask the question, well, why did you make that choice? Also another advocate, Dr. LeNoir, is this. We have cell phones now that are connected to, if they give you a medication, Google it. Google that medication. Google the indications of that medication. Don't just say, oh, this is a good medication. Okay, well, I noticed that it's not really indicated for Black people as well as this particular medication. Why did you use that one over this one? Because there's other medications. There's multiple medications to treat most illnesses and most ailments. Why did you choose this one over that one? Is it because it's cheaper, or is it because you feel like it's best for me? And so those are the questions, just some specific questions that'll get that change the quality and the level of care that you get.
One thing we don't want to leave on the table, there's a lot of unconscious bias among Black folks toward Black physicians. There are a lot of Black folks who are not willing to go to a Black physician. I don't believe that we're as well trained, we're as well educated, that we'll do as good a job. That's not a small percentage of the African American community. One thing they don't realize is that we are always given the option of taking care of the sickest group of people in the system. So your little problem is not that hard to deal with. But you can talk about it from your perspective, Dr. Hood. But I think there are a lot of African Americans, a lot of Black people with unconscious bias and will not go to Black physicians.
Well, I'm going to be honest. You're 100% right. Now you're talking about internalized racism. Well, we have taken these biases and internalized them, and subconsciously we believe them. And yes, that's true. And I can remember some 20 years ago, one of my patients I'd been following decided to bring their mother to me, and she was very withdrawn. And I believe I have a very engaging personality. And finally, the daughter said, well, Dr. Hood, you're the first Black physician she ever saw. And I said to her, am I the first Black physician you ever saw? I've always gone to Jewish physicians. Okay. So So what Dr. LeNoir is saying is 100% correct. However, in defense of our people as a whole, that has absolutely changed over the past several decades. I think more and more, I'm having patients who are now coming to me specifically because I'm Black, as opposed to 20 or 30 years ago. So yes, Dr. LeNoir, you're right, but I'm happy to say that I think that it is changing.
We do have a question. This is from Shonda. Shout out to Shonda. Can the information or causes physicians discuss on their personal or professional social media platforms be used as a proxy to inform you if the doctor cares about you? I would say, just as initial, and then we'll throw it to Dr. LeNoir and Dr. Hood. I would say yes, initially, because typically what happens when what somebody puts on social media, most people get very, very personal and they share it because that's the kind of what social media has been indicated to do. And so they kind of let down that wall. Now, some are they use social media as a way to promote their, themselves. But sometimes they let down that wall a little bit and they say what they're really feeling. That's how we got that doctor that got fed up in Alabama and said he wasn't going to treat any unvaccinated COVID patients anymore because he had just gotten fed up. He made that proclamation on his social media. And so doctors are now people are leveraging social media, especially as it becomes more and more part of our lives. People tend to be less guarded on social media and say how they truly feel versus when they're at work. We tend to button up a little bit tighter when we're at work and kind of let it go when we're on social media and at home. And so, yes, I would say, yes, you could utilize it, but don't let that be the only indicator. Because, I learned a long time ago, people tell the truth in two occasions. Three people tell you the truth. Drunk people, angry people, and children. So those are three. So if they're angry
and crazy.
I think that you're exactly right, and I think that we just want people to understand that you're running up against a system, and that if you're not prepared to deal with that system, then that system will overwhelm you, and there's a whole lot of bias in that system. So I want to just thank you, Dr. Hood. I think that any last words you want to give to our audience, any talking points that we've forgotten?
Yeah. Well, we probably need another hour, but let me say about unconscious bias, okay? I think unconscious bias many times is a cop-out, okay? It's a very plastic way of talking about racism. And
Right.
to me, it's the toxic unconscious bias based upon race, which is racism. And it is, most biases are probably not toxic, whether you like blue or red.
Right.
So when I talk about unconscious bias, I'm talking about the conscious bias that affects in a negative way the group that is being biased against. And if it's race or ethnicity or your gender, that's the type of bias I'm talking about. And I also want you to know unconscious bias is just as deadly as conscious bias.
It is.
And that's a good place.
It's more so.
And that's a good place to end our conversation. So thank you, Dr. Hood. Now, before we sign off the air, Mr. Dean suggested that many of the people that listen to our program, most of them are women, and that we should be we wanted to do a thing on Black men's health every week.
Yeah.
But we know that we don't have as many Black men as Black women listening to our program. However, you are the ones that determine what we do about our health. If I miss an appointment, my wife is on me constantly until that appointment is made. And I don't think she's alone. So we want to give a few tips for the health of Black men. Some of them are fairly generic, and each week we'll try to spend a few minutes just talking about that. I think there are a few things that you have to do for your partner, that you can say to them or talk to them about. One is get moving, move all the time. Don't sit around the couch or go to a fancy gym and just kind of lift a few weights. Don't be like my instructor. I had an instructor and I went down there to be evaluated, and he asked me to do a few push-ups. I did 3, and he told me how great I was and how much better shape I was in. But keep your man moving. Weight loss. Yeah, I know it's a sensitive subject for many men, but realizing that it's one of the parameters to every chronic disease that we do. And change your diet. We don't have to talk about that specifically, but to cut out the salt and sugar and eat more healthy foods and not so many processed foods and fast foods. And they should know their numbers, the numbers of blood pressure, cholesterol, PSA, and there are several numbers that we've talked about. So each week we'll try to focus in on one tip, so that if you're concerned about the men that you live with, or if you're a man listening to our program, we're going to have something for you every week. So that's all I have to say, Mr. Dean.
Absolutely. I will say, I will echo. One, I'm looking forward to our men's health series. So please make sure that you tell your male friends and your uncles and your cousins about our men's health segment each week. Also, I would echo what Dr. Hood is saying, is that unconscious bias is real. And it gets fed every day. All the images that we see, all the statistics we hear about Black men in jail and Black men in crime, all of that stuff feeds that unconscious bias and keeps it created in our lives. And so we got to make sure we've got to overcome that. Thank you for Shonda Rhimes and creating programs that have Black people as doctors and depict Black people in professional careers other than just being criminals. But we've got to do a better job of changing the narrative about ourselves. And so therefore, that's going to get rid of that unconscious bias, not start in our community of how we see each other, and then hopefully it'll go on into mainstream culture. Finally, I would say that as we move forward with Wellness Watch here, with the African American Wellness Project on BlackDoctor.org, I think it's important for all of us to be the driver of our own health outcomes. When we do the math, if we see our doctors once a year, that physical maybe lasts an hour. That's 1 hour out of 365 days that have 24 hours in each day. So the person that is most in control of your health outcomes is you. So Dr. LeNoir always says, health is your biggest asset. So protect it. And I will echo that sentiment. You have to be your own best health advocate, because if you don't have your health, everything else in your life is going to be secondary. So take care of your health. Go to BlackDoctor.org, go to the African American Wellness Project, go to our YouTube page, watch our Operation Life series. Right now, we've got hypertension, cholesterol, asthma, and COPD. And last night, we just did diabetes. That's 4 major health conditions that disproportionately affect Black Americans. If you watch those 1-hour programs, you'll be armed and ready to fight and how they indicate all other conditions that we typically face. So again, I want to thank you all for joining us. This has been a wonderful evening. Thank you, Shonda. You've been a wonderful, Ezra, Janice, YouTube, I said Yvonne over at YouTube. Andrea, I can't name you all, but thank you so much for joining us. And we'll be back next week. Next week, we have a wonderful, wonderful guest. We're going to have Dr. May on. And let me tell you something about Dr. May. She's writing a book. It's about to be released called Veganish. And so she's going to talk about how to be vegan, and she's going to talk about her journey and ways that we can incorporate more vegetables and a more vegan lifestyle in the way we cook and the way we eat. Because, Black folks, we like our bacon, we like our meat, we like to season it with our food. So we're going to find a way to eat healthier. And Dr. May is a wonderful, wonderful person, and I'm excited to have her come on next week. So y'all check out next week, and we'll teach you some ways to eat healthier with Dr. May. So we're signing off.
And I'm going to sign off by saying, health is your biggest asset, so protect it.
Great job, and the numbers support it. So we should have from what I'm seeing, we should have a good. We got a good crowd tonight. People are really active, so they really enjoyed the discussion. So I love it.
Hey, I enjoy every.
Should I end the broadcast?
Oh yes,